Hello, it's Dr. Rhonda Johnson, and today is Monday, March 1st, 2021. Boy, what a difference a year makes. A year is such an important marker of time, and as we start into this month of March 2021, we're going to be thinking and hearing a lot about the 1 year anniversary of this pandemic. And this may bring up some complicated emotions for some of us. It was March 11th, 2020, that the World Health Organization categorized COVID-19 as a pandemic, and it was March 2020 that many states put in restrictions, and COVID-19 became a household name here in the United States and around the world. So March may present for some folks unique challenges, and these may manifest as mental and physical challenges as we navigate through this month. And the news coverage is likely to be extensive with lots of footage of significant milestone events. Now, we know that many people have experienced loss of their loved ones and just untold suffering. Many people have experienced profound upheaval in their personal lives and in their day-to-day living. This impact has affected everybody, from children to teens to young adults, as well as adults and seniors. So some people may find themselves experiencing some physical and some mental symptoms this month, and it can range anywhere from restlessness to anxiousness to irritability to sadness to fatigue, insomnia, gastrointestinal problems, and shortness of breath. Now, everybody's not going to experience these, and some people may experience some others. But if you find yourself feeling little down, now I'm not talking about seriously mentally ill or suicidal, I'm talking about just a little bit down, then, some practices might go a long way. So I'm going to be giving some tips. My first tip is self-care practices, like in making sure you're exercising, getting enough sleep, engaging in meditation or prayer, and connecting with loved ones. Second tip, try something new and different on multiple days of this month. Experimentation might help you get through the month. Of course, it's safe experimentation always, because we have over 70,000 new cases just about every day here in the United States, and we're not doing as much testing. My third suggestion is to allow yourself to experience all the emotions that you're feeling right now. We're going to experience them. Number 4 is you may want to identify some grounding techniques, such as deep breathing or yoga or stretching, or, maybe getting a socially distanced massage. Don't forget there's free things like using your 5 senses to ground yourself, your sense of taste and touch and hearing music and conversation, and doing something visually like an art project, and of course touch. So use your 5 senses to help ground yourself. My 5th suggestion is to limit stressful media consumption and social media use. That's going to be really important. My 6th suggestion is to think about and practice gratitude. There's probably something that we're all grateful for. Even in this time, it helps to have a positive state of mind. Celebrate some new learning or something that you may have done that showed that you marked the time with something you might, be positive about. You may have said you read more books, or you did an art project, or you learned some new cooking skills, or you learned how to use social media, or you learned how to use video conferencing, or you did some sewing. I mean, there's a lot of things that people have done that are very interesting this past year. And as always, folks, if this doesn't work for you and you experiencing profound sadness or incapacitation, you may need some professional help. So please don't use this video as a substitute for medical advice or for professional mental health. My suggestions are just general and are for informational purposes. As always, my views are my own, and stay safe, stay connected, and I hope you'll get through this month okay.